The average person takes thousands of steps each day, resulting in the placement of extremely high pressures on your feet. This can lead to biomechanical problems with lasting effects. On top of that, everybody is unique and has a different walking pattern, which creates the need for individual treatment. There is no one-size-fits-all solution to foot problems. With foot pressure measurement technology, it is now easier than ever to evaluate your condition. This state-of-the-art system enables us to essentially see inside your footwear and under your feet to evaluate your condition. Assessing motion, and more specifically how you walk, has always been limited. Gait is dynamic and everything happens quickly. To make an assessment, we need to capture each movement from the second your heel hits the ground. Pressure mapping technology allows us to do that by capturing pressure data in each phase of motion, from heel contact to toe off. The information it provides on how your feet are functioning and how you are walking through abnormal pressure gradients helps us prescribe effective treatment for you. Using this technology reveals a host of various conditions that cannot be seen otherwise, whether it is to assess how effective your orthotics are, detect a limb length discrepancy, assess lower back pain, identify areas of potential ulceration for a diabetic, and even to evaluate surgical procedures. Athletics are a key area where assessing your foot function and gait is critical. When you run, your foot is striking the ground with roughly 3 times your body weight, and these pressures can create significant problems with body movement and function. With technology, we can now enhance technique and performance, evaluate and prescribe appropriate footwear for the specific activity, and retrain certain techniques and muscles after injury. Foot pressures are obtained by wearing sensing insoles or by walking over a sensing floor mat. The sensors are connected to electronics, which capture the data as you walk in real time. Vivid, easy-to-understand graphics will let you and your doctor see what is happening while you walk. High-risk areas, foot function, and gait can be instantly identified. Your treatment can then be planned and executed accordingly. The software displays the pressures with a color scale. Areas of red indicate highest pressures, while blue indicates lowest pressure. Illustrated representations of the foot precisely locate and demonstrate pressure distribution in real time. The user-friendly software will display your foot strikes dynamically as a movie, frame by frame. You can view side-by-side comparisons of before and after treatment to evaluate effectiveness. Data taken after treatment shows high pressure areas were reduced as evidenced by lack of red. Treatment attempts to reduce high pressure problems and walking disorders are difficult to assess without this test. With this data, we can objectively see the improvement. Diabetics are prone to developing pressure ulcers on the bottom of their feet because of their inability to feel the ground as they walk. This becomes extremely serious because this loss of sensation predisposes them to breakdown of skin and infection, which can eventually lead to amputation if not treated. Pressure measurement technology senses what you cannot feel and allows your clinician to offload potential sites of ulceration. Abnormal foot function is not something you have to live with. A computer-assisted gait exam assesses your condition in the actual environment that causes that particular problem. We can actually see what is happening while you walk and give you the best treatment for your condition based on this data. With computer-assisted gait analysis, you get better by being evaluated more thoroughly and receiving the most effective treatment. Ask us today about a computer-assisted gait analysis exam.